Hello, welcome back. Dr. Adam Rosen here today. I want to talk to you about a topic that is important. This is part of the preparation for surgery in terms that you might hear thrown around. So when you see your surgeon, they may tell you before surgery that you need to be cleared by your primary or GP or internist. And being cleared isn't really the best term. So what we like to say is that we want you to see your doctor so you can be optimized for surgery, specifically if you have a modifiable risk factor. So there's certain things if you're going to have surgery that are not modifiable, such as your age. So if somebody is older, they may be at higher risk. We actually did a study looking at patients in their 70s, 80s, and 90s, and what we found was the orthopedic outcomes were equivalent. They were similar, the same, but when patients were 90 and above, their chance of having some medical complication was higher. So age is a non-modifiable risk factor, but for a lot of other medical issues, conditions, diagnoses, they may be modifiable, and it is in your best interest to take the time to optimize those things prior to your surgery to lower the chance of you having a complication. So let's get into what some of those are. So first thing that we want to talk about is weight. If your weight is too high or too low, your chance of having a complication is higher. What's interesting actually is that they were shown in some studies that if your BMI, and although the BMI is not the perfect tool, although it's a tool that is easily calculated. So if your BMI is under 18, you actually are at an even higher risk of infection and complications than if your BMI was over 40, because those patients have less reserve. There's less soft tissue. There might be less nutrition. And this is going to be important for you to discuss with your primary, because if there is any way or possibility for you to optimize your weight prior to surgery, if you're low weight, to actually increase it so you have the appropriate nutrition to heal your wounds. And if your weight is significantly overweight, to do everything that you can to lower your weight prior to surgery to minimize the risk of a complication. The next thing that we're going to talk about, so this is a modifiable risk factor in certain people, is the skin. We talk about the soft tissue envelope. So if somebody is obese, some people carry it around their midsection. Some people carry it in their hips or their buttocks. Some people will carry it over their knee, and they'll have these folds of skin. And if you have folds of skin, that may be prone to wound complication issues. So if possible, you might change that. Did you have an old scar from prior surgery? That's a non-modifiable risk factor, but something that you should discuss with your surgeon, because what is the chance of having a wound complication if you have multiple railroad tracks over your knee from prior injuries? Lymphedema. So if you have chronic swelling of the legs, that may be worsened after surgery. But if you have chronic swelling and you have sores and drainage, that really increases your risk of developing a cellulitis and then a potential deep infection in the knee. And psoriasis. So a lot of patients may have psoriasis and they can develop a plaque over the knee. So I always let my patients know, if we're following them, usually they have to come off of their medications prior to surgery. And if they have a flare-up over the knee, we can't safely cut through that area. So to call the office, and we might change their surgical date to allow the soft tissue to heal. So we want a healthy, good soft tissue envelope around the area of the knee. Next thing, so next modifiable risk factor, tobacco use. So tobacco use, which I talk with all of my patients about, we know, or at least you should know, that it can cause mouth cancer, throat cancer, lung cancer. What a lot of patients don't know or realize in the orthopedic world is that if you're a smoker, that can increase your risk of a wound complication, a healing issue, infection risk, blood clot risk. So there are multiple reasons, aside from the overall general health things that are orthopedic and knee surgery related, to quit your smoking habit prior to the surgery to minimize the risk of infection. And patients ask, when can I go back to it? Well, preferably never, because it's bad for your health. But we want to get you through the window where your wound is healed, and a number of patients will resort back to that habit. But preferably if you can quit for the surgery. I've had a lot of patients that just needed some stimulus. They said, I needed a kick in the rear to get away from it, and then once they did, they never went back, which is great. Next thing, modifiable risk factor, diabetes. So diabetes is a bad disease, especially if it is uncontrolled. So we look at a lab called your hemoglobin A1C. If you're a diabetic, you should know what that number is. We want that number to be less than 7. Preferably, if it's less than 7, you're what's called a controlled diabetic. So your risk of infection and other complications may be a little higher, but it's as best as it can be. Now, the diabetes is a whole nother discussion about exercise, weight management, proper nutrition, things that may be non-medical or non-medicinal ways of treating or curing the diabetes if you have certain types of diabetes. But if you are diabetic, whether or not you're on pills or insulin shots, if your A1C is over 7, that is a modifiable risk factor. We want to pause surgery to make sure that your sugars are under the best control prior to having this elective knee replacement surgery. Because not only does it increase the risk of infection, but there was actually a study that showed that patients that had uncontrolled diabetes and had surgery not only increased the risk of infection, but increased the risk of heart attack and sudden death. So there's a lot of increased risks from having those sugars at an elevated point. So getting that A1C under control is important. Work with your GP or internist, or possibly see an endocrinologist. Next thing, anemia. So the risk of needing a blood transfusion in this day and age is quite low. Most studies around 1%. That is if your blood count is normal. And I've actually seen some patients that have pretty dramatic anemia that were, cleared by their primary. And we said, hey, pause. Why is this person anemic? Is their vitamin B12 level low? Let's check their B12. And if it's low, they might need B12 supplementation. Are their iron stores low? Check the iron studies. If your iron is low, you may have to take iron supplements to allow your body to then reboost your blood count to a normal level. And if you can't come up with a cause, then you have to talk to your GP. Do you have a GI bleed? Is it some other issue? Occasionally, if everything's normal and your body's just not producing enough of a particular enzyme, there's a medicine that we can use called erythropoietin that can boost your body's ability to bring your blood count up prior to surgery. Why? Well, it's just a transfusion, right? Well, transfusion is a procedure. It comes with risk. There is risk of infection, and actually patients that have blood transfusions may have a higher risk of an infection in their knee. You may have a transfusion reaction. If you're anemic after surgery, if you're anemic before surgery, and even more anemic after surgery, you're tired. You don't have the energy to participate in physical therapy. All of that can affect your outcome. Next thing, white blood cell count. For certain people, their white blood cell count is low. We want to know why. If your white blood cell count is low, maybe it's because of a disease or maybe it's because of a medication. Is it correctable? Because if it's low, you may not be able to mount the response to prevent an infection, and maybe surgery is not the best option for you until it's corrected. So looking at a normal white blood cell count is important. Next thing, low platelets. So platelets are a thing in the blood that helps your body clot to prevent bleeding. If you have a disease where your platelets are low, maybe it's secondary to a medication or an underlying disease, the question again, is it safe for you to have surgery? Because your knee will bleed. It's a normal process. And if the bleeding won't stop, that leads to severe complications. Possibly with your hematologist, if you do have low platelets, they may say, let's set you up for a platelet transfusion prior to surgery to get the platelet numbers up to a safer level. So platelets are another important thing. Now that the medical record is open, you can see all of these numbers. You have the ability to look at those labs and see where do you stand as far as these numbers, and are they normal for you, or are they a concern for your upcoming surgery? Next thing, kidney function. The specific labs you're going to look at are what's called your BUN and creatinine. They allow doctors to assess your kidney function. There are some other tests that they may do, but if your kidney function is poor, again, the question comes down to why? Do you have diabetes? Do you have high blood pressure? Is it a medication that you're on? But patients that have kidney disease, if they have renal disease, that group of patients, of all of the things that we're talking about, have some of the highest risks of complications after knee replacement surgery. So again, it may not be a modifiable. You may have a chronic kidney disease that's been stable for many, many years. You have to accept the risks. But if it has gone up recently and dramatically, you need to hit the pause button, talk to your primary and find out why, or see a kidney doctor, a nephrologist, and see, is there a way to correct the problem that has developed before you have this elective surgery. Next thing, liver disease. If you have chronic liver disease, if you have a history of drinking or some other disease like hepatitis or something that affected your liver produces a lot of the things that are important for clotting. And again, if you have liver disease, that may affect your body's ability to clot and stop bleeding after surgery, which can lead to a major complication if you bleed excessively. So talking to your doctor, possibly seeing a liver specialist, a hepatologist, to see whether or not there's anything that they can do to correct that problem prior to your elective surgery. Next thing, and this kind of fits in with something that we talked about before, but was nutrition. So one of the labs that we typically look at is called your albumin, and it's a marker of your protein stores and your general nutrition. You can be overweight, you can be obese and have a poor nutrition lab value. You can be underweight and have a poor nutrition lab value. But if your albumin is low, the risk of you having a wound complication, which can then again lead to an infection, is higher. So it's different if you had a car accident and you have to have emergent surgery. There's no time to fix those things. But if your albumin is low for some reason, you need to talk to your GP and find out why. Maybe see a nutritionist. You may need other labs to look at certain nutrient lab values and figure out why, but you need to increase or boost your nutrition into a normal level before you have this elective total knee replacement surgery. Next thing, rheumatologic diseases, what we call DMARDs. These are disease-modifying agents. Sometimes people are on chronic prednisone. Whether or not you have lupus or rheumatoid arthritis or some other disease, you need to coordinate with your rheumatologist and your orthopedic surgeon. Can you be on your prednisone? Do you need a stress test or stress dose at the time of surgery? Are you on certain medications for these diseases that increase your risk of wound complications or infection? And do they need to be stopped before and after surgery? When and for how long? So if you're on these medications, it's important that you discuss this with your care team to lower your chance of having a complication. Next thing, cardio. It's a big thing we see a lot of times is patients that have cardiac disease, whether or not you had a heart attack or you have heart failure or you have an arrhythmia, are you on a blood thinner? And if so, when can you safely stop it prior to surgery? It may depend on your disease and what drug you're taking as to the time frame. How quickly do you need to go back on it? What is the increased risk of bleeding because you're on that blood thinner for your heart? And then do you need extra tests? You might talk to your cardiologist. They may want to do a stress test or an echo to look at your heart prior to surgery. And there may be more monitoring after surgery that they would recommend. Do you have a pacemaker? Do you have a defibrillator? It's always good to know the brand so you can coordinate with the operating room if that device needs to be interrogated during or after the procedure. Next thing, pulmonary disease. So if you have chronic pulmonary disease, COPD, emphysema, other things that may have affected your lungs, important to see your pulmonologist because that can affect your ability with both anesthesia and after to breathe properly. That could lead to pneumonia or other issues that could affect your recovery if you're having difficulty breathing. So if you're a patient that has chronic lung issues, get your pulmonary team involved. Next to that, and along those lines, are what we call venothromboembolic disease. The question that we ask is, have you ever had a blood clot in your leg, in your lung? Why? Because when we do this surgery, there is a risk of bleeding, or of getting a blood clot, rather. And if you have a blood clot risk, you're at increased risk for a blood clot after this surgery than the normal people. No one's low risk. So if people are low risk, we might put you on a medicine maybe like aspirin. If someone's higher than normal risk, we put you on a blood thinner. The downside of that is it can increase the risk of bleeding, but the upside of that is it's trying to lower the chance of you getting a blood clot either in your lung or your leg. The other thing, which I think a lot of people are sort of not aware of, though, are the psychological components. So I talk to my patients that if you have depression, if you have an anxiety disorder, if you have those things, it's important, especially if you have a therapist that you're seeing on a regular basis, to talk to them about your upcoming surgery, because this surgery can cause pain. This surgery stresses people out. This surgery can cause anxiety. A lot of people feel withdrawn and loss of independence after surgery and feel depressed. So if you already have those things, they may be worsened or magnified in your post-operative period. So you want to talk to your team to make sure that if you're on medications, you have the appropriate dose or the appropriate resources to reach out to them if you're having problems. Other thing, dental. So there's a big discussion now about whether or not dental prophylaxis after surgery is still needed. But we want to make sure that your teeth are in good order. If you have a cavity, if you have an abscess, they're all potential sites of infection. And it's a relative contraindication that if you're having surgery, you don't want an active infection somewhere else in your body. So it's really good to, one, take care of your health or your teeth health on a regular basis. But if you have active disease, it is something to talk to your orthopedic surgeon about if they don't bring it up, and talk to your dentist to make sure that you can have those mouth issues addressed prior to this elective surgery. So a whole lot of information. I'm going to break it down in the show notes with chapters, because if you don't have some of these problems and you want to skip over it, skip over that. If you've gotten to this point and you've listened to it all, great. You're more educated because of it. If you have not already subscribed to my channel, please subscribe. If you like what you're hearing, click the thumbs up button. If you like information like this, you can check out the book that I wrote a year or so ago called The Knee Book. It talks all about knee replacement, the expectations, the recovery, how to get a good outcome, what are the complications. So it answers pretty much all of the questions that most people that I've run into have had. And click the little bell button below so you will be updated when new videos like this come out again in the future. Thanks again for listening. I'm Adam Rosen. You've been watching me on my YouTube channel. Please stay safe, stay active, stay healthy, and if you have upcoming surgery, take this information to heart and work with your primary team to make sure that you're as optimized as possible for your upcoming knee replacement surgery. Take care.